is an ophthalmologist, an optometrist, and an optician? Many people are confused about the difference between an optometrist and an ophthalmologist, as well as the difference between an optometrist and an optician. That is why most people see an optometrist and call him or her an optician, while they see an optician and refer him or her as a doctor, or call him or her a doctor. In this video, I'm going to be explaining the difference among these eye care practitioners, as well as their role in eye care practice. An ophthalmologist is a medical doctor that is specialized in eye care management. He or she is responsible for carrying out eye examination, diagnosis, treatment, management, as well as surgical procedures like cataract surgery and glaucoma surgery, while an optometrist is a primary health care practitioner that is responsible for eye examination, diagnosis, treatment, management of different kinds of visual disorders using drugs, corrective lenses, and other means of eye care management, excluding surgical procedures like cataract surgery and glaucoma surgeries. An optometrist can only carry out minor surgical procedures like foreign body removal, incision, and curettage of style or chalazion, and management of post-surgical procedures, which means that an optometrist can manage a patient who has gone for cataract or glaucoma surgery, while an optician is a technician who is responsible for cutting and fixing of corrective lenses and contact lens, which means that an optician, this is the job of an optician. An optician helps you to select a frame that will fit your face and also cut out the power and fit it into a frame, and also contact lenses and other devices used in correction and management of visual disorders. This simply means that an optician is not a doctor. An optician is only a technician in eye care practice. He or she is not qualified or licensed to carry out eye examination, diagnose, to treat or manage any kind of eye or visual disorder. There is a relationship that exists between an optometrist and an ophthalmologist, and there is also a relationship that exists between an optometrist and an optician, which makes an optometrist a middleman between these two. Now, the relationship between an ophthalmologist and optometrist is that in a standard hospital, a patient with visual disorder is being directed to an optometrist first, who examine and diagnose he or she of any kind of visual disorder. If it's a condition that requires the attention of an ophthalmologist, such as a mature cataract that needs to be surgically removed, an optometrist refers this patient to an ophthalmologist, who will then decide on when and how to remove this cataract from this patient's eye, while the relationship between an optometrist and an optician is that exists between a general practitioner and a pharmacist. An optometrist, after examining a patient, especially a patient that requires lenses for correction of eye disorder, the optometrist, after testing the patient and getting the power required to correct this visual, sends the prescription or simply the power that is there, that will be here, to an optician, who will then cut out this lens and fit it into a frame before the frame can be dispensed to a patient. So an optician is like a pharmacy who dispenses drugs to a patient. Aside the ophthalmologist, the optometrist, and the optician, there is another important eye care specialty that people rarely know. These are the orthoptists. An orthoptist is an eye doctor that is responsible for management of eye movement disorder. Eye movement disorder, that I simply mean is, I know that many times you see people whose eyes move uncontrollable, or people that are commonly called the people with half past 4 eye or 4:30 eye. I mean this category of people that if they are talking to you or looking at you, their eye is somewhere else. I don't know if you understand. These kind of people are people with eye muscle disorder. Medically, they are called strabismic patients, mostly managed by an optometrist who manages this kind of condition using visual therapy such as eye exercise, corrective lenses, prisms, and other techniques, excluding surgical procedure. So technically, in eye care departments, the major people that carry out eye surgeries are the ophthalmologists. Most times, these surgical procedures are carried out with an optometrist in the theater as an assistant, while an optician is a technician that cuts and fixes lenses into a frame according to the directives of an optometrist. Now that you have consumed the knowledge in this video, you know what to do for me. Like, share, and subscribe to my YouTube channel. See you next time.